Hello everyone, and thank you for the opportunity to present to you today. My name is Margaret Gillis, and I am the Senior Director of the Division of Children, Seniors, and Healthy Development with the Public Health Agency of Canada. I sincerely regret that I'm unable to join you in person today, but am pleased to be able to share some of our Canadian experience in emergency preparedness policies and approaches specific to seniors. Public health is defined as the organized efforts of society to keep people healthy and prevent injury, illness, and premature death through a combination of programs, services, and policies. In Canada, public health is a responsibility that is shared by 3 levels of government in collaboration with the private sector, non-governmental organizations, health professionals, and the public. Our agency's role is to promote the health of Canadians and to prevent and control diseases through leadership, partnership, innovation, and action in public health. We do this so they may participate fully in their communities, including during emergency situations. Lessons learned from reviews of past disaster situations, both national and international, assist in achieving these goals. The cross-jurisdictional nature of Canadian public health also means that we cannot work in isolation to address these challenges and must often work closely with a number of other domestic and international partners. I am happy to say that Canadians are living longer and spend more of their years in good health than ever before. In Canada, life expectancy at birth for men is 78.3 years and 83 years for women. By 2015, seniors will outnumber children for the first time in Canadian history. In Canada, our seniors predominantly choose to age in place rather than move to institutional care. Only 7% of seniors live in specialized care facilities. Furthermore, a quarter of those 65 and older live alone. This means that in emergency situations, older persons living in their homes are potentially isolated and at risk, particularly those in rural areas. An older person with several chronic conditions may be able to cope very well under normal circumstances and with the necessary medical and social supports. However, if medications and assistive devices are unavailable during an emergency, the older person could quickly become vulnerable. For maximum effectiveness, age-responsive emergency management should examine and address these factors. Specific environmental disasters in Canada that have highlighted the need for emergency response that integrates the unique needs and contributions of older adults include prairie fires, severe flooding, and extreme weather conditions. According to Health Canada's Climate Change and Health Office, climate change scenarios project an increased risk of extreme weather events in Canada. Changes associated with climate shifts that are already evident in Canada include increased coastal erosion, permafrost degradation, and decreased snow cover, particularly in the north, and lower water levels. Climate change may result in the emergence of diseases previously thought to be rare or exotic to Canada, for example, Lyme disease and West Nile virus. The Government of Canada's role is to help inform Canadians of the impact of these changes so they can adapt their responses and keep safe. To determine the level of Canadian recognition of these factors, Health Canada recently conducted a climate change awareness survey. The bad news from the survey was that Canadian seniors were the least likely to be able to name at least one climate change risk to health, least likely to think that climate change or extreme weather are linked with health risks, and less likely to think that either they or their community are vulnerable. The good news from the survey results were that Canadian seniors are the most likely to report having a household emergency kit or to regularly check for extreme weather information. However, this survey reinforces that governments need to increase public awareness of health risk factors associated with climate change. This can be achieved through outreach activities at all levels of government and across sectors. For Canadian seniors, increased awareness could improve preparedness at an individual level. Outreach efforts could encourage professionals to build climate change risks and hazards into existing approaches. In keeping with Help Age International's guidelines, we believe that the factors placing older people at risk need to be well understood to be addressed, and particularly to effectively integrate them into approaches that serve the general population. Canada recognizes the importance of enhancing public health security through empowerment and involvement of older people in the development of policies and programs designed to address emergency contingencies. Since 2006, our agency has collaborated to bring together the fields of emergency management and gerontology to exchange knowledge, create new partnerships, and build a foundation for action. By working with Canadians and international experts, research has been moved into action, priorities have been identified, and new networks have been created to move these priorities into concrete outcomes and to share tools and resources. Examples of these outcomes include development of international case studies on seniors and emergency preparedness, an international workshop bringing experts together in Winnipeg in 2007, development of a framework for action that was presented to the United Nations Commission for Social Development, as well as preparation of an advocacy brief outlining key issues and practical guidance for the United Nations humanitarian community. The government continues to work on the issues of seniors in emergencies. I will speak to just a few of these today. These projects aim to support seniors' health and function while preventing injury, illness, and disability, even during challenging circumstances such as emergencies. Firstly, I will speak to the e-learning tool entitled Frailty, Dementia and Disasters: What Healthcare Providers Need to Know. We worked with the Canadian Dementia Research and Knowledge Exchange and Dr. Maggie Gibson at St. Joseph's Healthcare in Ontario to create this bilingual e-learning tool. This tool comprises 4 modules that outline important steps to improve emergency preparedness, as well as the role of healthcare providers in protecting older people. In 2012, we worked with the Canadian Dementia Research and Knowledge Exchange and Dr. Gibson to deliver a successful series of facilitated webinars to promote uptake of the concepts and approaches in the e-learning tool. This resource is available free online at the website listed on slide 8. The next project I will speak to is the development of a resiliency-based community intervention. From 2010 to 2013, we supported the Enrich project along with partners. This project identified and implemented interventions and tools to enhance resiliency among seniors and other at-risk populations in 5 communities. The partnership with the targeted communities and other Canadian and international organizations were instrumental in the project's success. As part of this project, an international conference was held to disseminate project findings. A key outcome of this conference was the creation of the Enrich Collaboration, an international partnership for stakeholders involved in resilience-oriented activities. You may also be interested in the Enrich International Research Network, a multidisciplinary group of researchers collaborating on research projects and student mentorship. The website for this project is on slide 10. I invite you to consult it and to be inspired to adopt the project's collaborative approach to building more resilient communities. I will also speak to our colleagues' work at Health Canada's Climate Change and Health Office, which monitors and assesses health risks associated with our changing physical environment. In addition to their role in enhancing scientific knowledge, the office identified the importance of direct health messaging to improve personal adaptation to heat extremes. In particular, through the Heat Resiliency Project, this office published advice for frontline workers, organizations, and the public, including heat health brochures with tips to protect older adults from the extreme heat. The Government of Canada continues to work on new and innovative approaches to address seniors' needs in emergencies. The agency is currently developing the Emergency Management and Older Adults Policy Lens for frontline workers. This is a tool that can be applied to any policy, program, or practice that directly or indirectly affects older people in emergency or disaster situations. The lens is essentially a set of key questions that can be used both as an analytical tool as well as a process tool. It can be used as an all-hazards approach. The lens is most effective when used in collaboration with older people and other organizations affected by the policy, program, or practice. We are currently working to make this available. We know that seniors have been disproportionately represented in the number of people displaced, injured, and killed in emergency situations. As one of the population groups least likely to prepare for and physically recover from the effects of a disaster, the needs of seniors must be taken into consideration. We have worked with a wide network of stakeholders to develop practical information that helps communities and emergency responders assist at-risk seniors. That said, it is important for us all to recall that seniors are not just a vulnerable population. Being in need and being able to contribute are not mutually exclusive. Many older adults make great contributions by serving as volunteers to provide outreach, information, practical assistance, and emotional support to their communities and families. They are a key resource in the community and are essential to effective planning and response. In Canada, many seniors enjoy good health and active lifestyles and have life experiences and knowledge that make them more resilient. I believe this is a key recurring theme throughout the international community, and it is an important component in effective and innovative development of policies and programs designed to assist emergency contingencies. Thank you for your time.